Good evening. Welcome to your nightly newscast here on RIC TV. I'm your host, Dimitri Awas. Tonight we begin our broadcast with a story coming out of Providence, Rhode Island. We will be examining a recent herpes outbreak in the city. Who's being infected, what is the cause of infection, and how we can stop it. The often tabooed infection has recently been reported within our city at alarming rates. Here to speak with us about the herpes simplex virus is Dr. Alan Burrell, professor and head of health science department at Rhode Island College. Good evening, Alan.
Good evening. Thanks for having me.
Doctor, if you may, what seems to be going on here in Providence causing this recent outbreak?
Well, the recent outbreak can be related to carelessness and lack of sexual protection. For example, sharing partners and not using latex condoms. Considering that genital herpes is found in 1 out of every 6 people between the ages of 14 and 49 nationally. The CDC also estimates that 776,000 new cases of herpes are reported annually in the U.S. alone.
So, doctor, what exactly is herpes, if you could describe it for the people watching at home?
HSV-1, or the commonly known STD herpes, is a virus. It has 2 forms, simplex 1 and simplex 2. HSV-1 has traditionally been characterized by childhood transmission causing orolabial or cold sore lesions, and HSV-2 by sexual transmission causing genital herpes.
And how can HSV be transmitted?
Infections are transmitted through contact with lesions, mucosal surfaces, genital secretions, or oral secretions. HSV-1 and HSV-2 can also be shed from skin that looks normal. Generally, a person can only get HSV-2 infection during sexual contact with someone who has a genital HSV-2 infection. Transmission most commonly occurs from an infected partner who does not have visible sores and who may not know that he or she is infected.
Doctor, what are signs and symptoms that we should be looking out for? And how can you be treated if you do come across those signs and symptoms?
Most individuals are asymptomatic and signs go unnoticed, meaning that most infected people are completely unaware of contracting the disease. When signs do show, they appear as vesicles on or around the genitals, rectum, or mouth. Other signs and symptoms include headaches, fever, and swollen lymph nodes. As far as treatment is concerned, there is none. We have yet to be able to cure the herpes virus. However, there are medications that can prevent visible outbreaks.
So, doctor, in health sciences we are familiar with the 3 W's: who, where, and when. Can you categorize those 3 factors in the context of the virus?
Of course. Those who are being infected could potentially be anyone in direct contact with one who is already infected, anywhere from casual kiss to sexual contact. Those most commonly affected are women, who show a 20% rate of carrying the infection, as opposed to men who are at a 10% rate. Also, non-Hispanic blacks are more common to having HSV at a rate of 41% than are non-Hispanic whites at only 11%.
All right, when and where can we see these cases being reported?
Infection can take place anywhere. Higher population will see higher cases from city to city and state to state. Societies that were more accepting of numerous sexual partners will see high rates as well. As far as internationally, lesser developed areas that lack in accessibility, such as sex education, forms of contraceptive, and health education, will see high rates. The incubation period is usually 2 to 4 days and stays in the body indefinitely. However, outbreaks decrease over time, with HSV-1 showing up less frequently than HSV-2.
Now, doctor, what are some preventative measures we can do to avoid contraction and further spread of the disease?
The surest way to prevent herpes is to avoid any sexual contact. If we choose to have sex, we must correctively use latex condoms. This still may not be enough to fully protect us from contracting HSV, but it is a start. We can also limit ourselves from sharing multiple partners. Primary prevention can help as well. We must get tested frequently for any STDs. And finally, those who do not have herpes must be honest with the future partners before performing any sexual acts.
There you have it, folks. Spoken words from Dr. Alan Burrell. I would like to thank Dr. Burrell for his time and vital information here tonight.
Thank you. Thanks for having me.
I also want to thank the audience for tuning in. Please be careful out there and be sure to be aware of all you have learned today. Please remember to practice safe sex and get tested. Nothing is more important than your health. Your body is a temple and you must treat it that way. I also want to invite you all to tune in again next week, where we'll be discussing health tips on exercise and eating clean, staying away from GMOs and the recent trends in veganism. Thank you all again, and good night here from RIC TV.